the question of failure is really interesting. So when a provider is taking care of a child who is quite ill or really complex, I think providers sometimes don't recognize the exquisite care that has been given to a child that enables a child to continue to live. Because children live now who are incredibly medically fragile. And the reason is because of the exquisite care given by their families and by medical providers. And I wish that providers would honor that more, because it's extraordinary. Now, when children die, I do think that providers sometimes feel a sense of failure. And in fact, when my child passed away, one of the members of his team apologized for having failed. And it was surprising to me because that was not a construct that would have ever occurred to me. My son had a disease that was always fatal, so that nobody who'd ever had this disease in the world had ever survived. There was an inevitability about it for me, which is not to say that I was at all happy about it, but the construct of failure never occurred to me. And I will say it made me sad. So for the providers. So I think that medicine can do such extraordinary things, and often that is taken for granted, so that when a child does die, it does feel like a sense of, it is experienced as a sense of failure. And I don't know what a provider can do other than just to recognize that one can feel that way. And perhaps it is an indication of how much the provider really cared for the child and was committed and devoted to preserving the child's life and quality of life.
I have tremendous respect for my colleagues that are doctors and nurses, because when a child dies in the hospital setting, not only is that care provider working with a grieving family, they also have other patients and families that they're caring for. And I want to acknowledge that it's incredibly difficult, the work that doctors and nurses and other care providers do. And it's so important to find ways to honor the work that providers do. And it's not an easy thing to do, but it's important.
In the hospital where I work, we have a practice called reflection rounds after the death of a child. And the team members get together not to talk about the medical situation, not to talk about the care per se, but merely to honor the care that was given to the child, so that team members are able to come and tell stories about a particular day when the child was very happy, to remember specific things about the child, the wonderful love and care that the parents gave to the child. So just an opportunity to honor the care that was given to the child, which I think is a really important way to process. I was involved with a project in which I interviewed residents about children that they had cared for who had passed away. And I was so moved by the depth of feeling that residents had for these children and how they carried memory of these children with them throughout the rest of their lives, how they were crushed when children died, just carry deep, deep sadness. So to the extent that one can acknowledge that this is going to be the way that it is,